Can we touch on something quickly? In your view, what are some of the things that people don't realize are happening there that they've been given the wrong impression in the news? Like things that the news is saying this, but you've seen with your own eyes and you've witnessed with your own hands the opposite or something different.
There's a guideline to work on. Like there's steps you need to take while you are taking of the patients. Over there's no rules in Gaza. You need to work with what you have. Like sometimes there is no gloves. And one day there is no head cover in the procedures room.
How is it that people still have this idea that famine is a lie? I'm sure you've seen it. People keep repeating this in the West, in America. It's unbelievable, and it just shocks me. Saying that, oh, no one's starving. It's all just propaganda. It's all just bullshit. What do you say to that from what you've been in contact with people on the ground, operating in operating theaters, in hospitals, in clinics, trying to do the best with all the circumstances and picture you painted of what it's like to be a healthcare worker in that environment? What do you know to be the truth?
Let me tell you something. When I was there, my lips start bleeding because the water what we using, it's from the sea and it's salty. Salty for a level that you are on the second day your lips, because when you do wudu, and the second day you will start bleed. I swear while you are in Gaza you're gonna be wish cup of water, not salty, not food. And I know doctors there are starving. Doctors there are lying now, falling down in the procedure room. Doctors, not patients, because they've been 3 days without food and they just take one normal saline by IV.
They take saline by IV.
Yeah, normal saline.
In order to continue functioning.
Yeah, instead of the food, there's no food.
Doctors. This is doctors who
doctors. They take it, they drink water with salt, with sea salt. They mix them together and they drink it.
For electrolytes.
Yeah, just to make sure that they are not going to dehydrate. Omar, when we make a procedure for hours to save someone's life, this patient needs food to make sure that his wound doesn't get infected, right? Those patients, they come back to the procedure room to do amputation because they're not eating.
So people are losing their limbs because of their malnutrition.
Yeah, there's no food. There is no food. What are you watching on the TV from people saying that we are starving 10% from what over there? If you've seen in your eyes what is the starving mean there, you will not believe it. The press of TVs, they drink water and salt. They have no food.
I want to ask one question, which I have to ask on behalf of all the naysayers, all the people who will listen to everything we've said and they'll say one thing, and you know what it is, one word. They'll say Hamas. That's what you always hear from people who are on the other side of the aisle on this. In your experience in hospitals, clinics there, what has been your experience in terms of the hospitals and Hamas running around and just doing whatever they want and running these places like the way they portray it on the news? What have you seen?
Like this question everybody asking me.
What do healthcare workers in Gaza, or just Gazan people in general, want people outside of Gaza to know? What would be their, message to the outside world? If you can direct people's energy who want this to stop, people who want this to stop, if you can direct their energy in one or two directions, like in one area, one focus, or if you keep it simple, what would you want to see more people in the United States doing that could help potentially bring this to a stop, if anything? We are rolling. Today, I want to share with everyone that we have with us in the studio here next to HaRLeM, Dr. Ibraheem Barhouma. What I want to start off with before we get into introducing Dr. Ibraheem and going into some of the details of his experience in Gaza is just to remind everyone who's listening that in order for this podcast to be able to bring guests and stories and information that's high quality, it does require a lot of work and a lot of effort that goes into this. And for that reason, I do always start off the podcast requesting that everyone who's listening to please do me a favor and subscribe to the channel. And also like the episodes that you feel mean something to you. Even if you don't listen to the whole episode, it really helps to see those likes. And then lastly, probably the most important thing is if people can share at least one episode that resonates with you, with people that may not have any awareness to this podcast existing, especially those of you who have non-Muslim or American friends who really don't have much of a connection to these issues necessarily. It would really help because the goal of the podcast is to get people who are outside of our community, I would say the Muslim, Arab, Palestinian community specifically, to get those people to understand more about us and to understand more of our issues and concerns, and really to try to build bridges with other communities within the United States of America. So that's enough for my plug for the podcast and for my ask of the audience. And so with that, we'll transition here to marking the date. The date today is August 1st, 2025. And the reason why I say that is because it's important to mention before we start off this discussion that we are at the point, official numbers, if you Google, for those who are listening, the actual death toll in Gaza has reached over 60,000 people. That's the official published toll that they repeat in the news cycles. And over 150,000 injured since October 7th, 2023. And so now in the media, we've all seen more and more of the podcasting world, more and more of the traditional and even non-traditional media picking up stories of what is happening in Gaza in terms of widespread hunger and famine, as well as some incredible stories coming out more recently, just this past few days, from people such as Tony Aguilar, a long-time 25-year U.S. military veteran who was volunteering in Gaza and witnessed some of the atrocities and crimes that are going on around the food distribution sites. So now I think that the American public is even more clued in to what is happening and paying more attention ever than before as to what is the actual story unfolding on the ground in Gaza. And so with that timing, I think it's very appropriate for us, and I'm very humbled and honored to have in the studio with me someone who has actually seen with their own eyes, who has worked with their own hands in Gaza and in the healthcare and health services capacity, providing emergency and trauma care to people who are going through things that are completely, unfathomable, unspeakable to us as people living in the West, Muslims, non-Muslims, you name it, any walk of life living in the West can really not fully wrap their heads around what's going on or imagine what's going on over there. So with us is Dr. Dr. Ibraheem Barhouma. He has direct experience on the ground in Gaza, and from talking to him and getting to know him, I think that what he has to share is extremely important for anyone who cares about human rights, anyone who cares about basic justice, and most importantly, stopping the onslaught of violence and death that is occurring every day in Gaza. So without further delay, I want to turn it over to Dr. Ibraheem Barhouma to give a little bit of an introduction as to who he is, his occupation and background a little bit, and we'll slowly take it from there. Welcome to the studio, Dr. Barhouma. It's an honor to have you. I'm really pleased to be sitting with you. And so why don't you maybe introduce yourself and tell us a little bit about your background and profession.
First of all, I would like to thank you, Omar. And before I introduce myself, I would just like to add a couple numbers for the numbers that you just mentioned. Until today, we have another 15,000. You need to add them in the top of the number that you said. Those we couldn't get them. We could not. They could not get them out from under rubber because there's no tools to do that.
So estimated 15,000 more, or 50,000 more? 15,000 more that are under the rubble, that have not been removed.
They said it's lost. But lost where? Under the rubble. There's 3,150 women miscarriage in the second trimester or first trimester, which is, you talk about, after the 120 days, the baby's inside. He's a baby. So you talk about a person. He's a.
Yeah, I can explain. Can I explain one thing quickly? I think in America, we're so accustomed to the abortion debate. There's a lot of debating between different sides within the political spectrum around abortion. And a large population of the United States, I'd say half or more, believe that life begins at the moment either of conception or at least for sure by the time we enter the second trimester or the end of the first trimester. So if you count it in that sense, you're talking about another 3,150 lives, babies' lives that were taken that are not counted in the official numbers.
Yeah, those people that you need to add this number because of they can't find the food to eat to survive. The mom
to sustain the pregnancies.
There's no vitamins that we all pregnant women take it. There's no food, which is, when one of our wives get pregnant, we start bringing everything's good. Oh, we need to get that and this and this. Oh, this is with the multivitamins. This is good for ferritin. This is good for the iron. Those are not there. And you need to add another almost 2,500 family. They're gone. The whole family. When we talk about the whole family, we talk about 3 categories. Dad, son, and uncles. Because, in Gaza, usually Gaza, it's a small city. It's at only 360 kilometers, which is the family is there because they are under since of 17 years. They blocked everything on them. So the families there, they are all live in the same building. Uncles will be in the same building. Let's say the building will be 6 floors. So you will see 6 floors of all brothers with their moms and dads and with the kids. 2,500 family, they're deleted from the documents of the country.
From the civil registry.
Yeah,
Gone.
they're gone. Talk about 3 generation. See how 3 generation. And there's almost 1,700 solo survive. 40,000 kids in Gaza until today either lost dad or mom or both.
How many?
40,000.
So you're saying 1,700 sole survivors, meaning people who are the last member of their family alive.
Yeah.
Their entire rest of their family has been wiped out.
Yes. And he's injured. Most of the cases, he's injured too.
So that's a better painting of the picture, I think, than just rattling off numbers that you get off of Google and online or in the news headlines. So I think this is really important. I'm glad you put in the context there.
Those are the official numbers that we got. The only number it's more, I think, which is the 2,500. I think now it's more than this, and the portion is more than this.
And I'm sure the numbers will all increase if time
Every second
allows for people to go in and verify everything.
Omar, it's every 15 minutes there is a kid die.
Yeah.
Every 15 minutes. It used to be every 17 minutes. Now it's every 15 minutes. This is an official number. But we are not numbers.
We'll talk about that. We're going to talk about that, I promise.
My name is Ibraheem Jamil. I graduated from University of Jordan as a clinical doctor of pharmacy in 2009. Moved to the United States at the same year. I got 2 licenses over my pharmacy, which is the first one as a surgical technician with the vascular surgeon. And the second, it's wound care consultant. I have 3 kids, I'm sorry. I forget the third one. He just came 6 months ago.
Congratulations.
Thanks. I have 3 kids, 2 boys and 1 girl. And a wonderful wife. That's all.
And how did you get into this profession? I guess just what attracted you to it? I think motivation is really important when we talk about some of the stories that we're going to hear. I think the motivation is important for people to understand the trust of the information and knowing the kind of character behind the person who's telling these stories. So can you tell us a little bit about what drew you to healthcare and wanting to be in this particular field?
Okay. You're going to be shocked if I told you since I'm 6 years old until 18 years old, I always think about to be an electrical engineer. But like while you're growing up, the picture will be more clear for you. I come from family that there was one of the families in the Nakba, 1948. They evacuated to the Jordan in 1948. My grandfather, he's one of the people that has died in Palestine, 1948, at the area called Sarafand al-Amar. If you look up for this area, you will not find it maybe, but it's the same area that where is now the airport of Israel. This story that I listened from my grandmother, she told me the whole story since of how they like start moving from their city to another city to another city. And my dad was born during this time because he was born in 1948. And he's the solo son for his mom, the one she just got married. And her dad, his dad, like my dad, he come to this life without father, and his father dead mostly without knowing that he have a son. And they moved to Jordan, as you know, in 1948. We grew up there as one of the old Palestinian families in camp. And my dad, he started building himself by himself because he didn't want to stay in a camp. And he moved to, let's say, at that time, to the city, from the camp to the city in 1970 something. Why I'm saying this? Because this will give you a lot about how much Palestinian people that they are kicked out from their land. Their fight to live again, because like, just think about it, those people, they have homes, they have lands, they have money, they have everything over there, and they lost everything and they start from the beginning. The same like what happened now in Gaza. The histories come back again. So he didn't study in the beginning because, you know, he's the only kid in the house with his mom, and he needs to take care of his mom. So he didn't study in the beginning. Maybe he studied like just maybe for the 4th grade. Then he started working. But after he reached, I think, the 30 years, he started studying again, and he finished the high school. You know, we over there we have a exam for the high school توجيهي, they say it, and he got a good score, and he started studying law in American Lebanon University. But he unfortunately, alhamdulillah, was died in the 4th year while he's studying, which is 1991. He's died. Well, he was 43 years old, and he do have 10 kids, 5 girls and 5 boys. When he passed away, I can't remember him, to be honest, because I was 4 years old at that time. So my biggest brother, he was 17 years, and my youngest sister, she was 6 months at that time, and my mom, she was 32 years old. So I think this is enough to tells you something, like why my dad he died, because as a Muslim, we know like he's gonna die anyway, because
Everyone dies at some point, and
exactly,
God decides when.
But
it's part of that is in the hands of God.
When he used to live in the camp, you know, at that time, the UN, they are the one who responsible about the medical, taking for them as a medicals. There's like centers for the UN. They thought that they have a disease, which is he's not have. He have kidney failure, but they doesn't know in the beginning. After that, they know. After, like, let's say, after we lose the chance,
It's too late.
yeah, it's too late. So he lost one of his kidneys, and the other one was like working maybe 25%. This will give you another image that those people, they did not take the rights in a medical part. When you have a lot of people, we're not blaming the UN in this side, but we blaming the one who was the reason for this
The
side.
circumstances.
Exactly, because it's a camp. There is a lot of people there. Like when you have one clinic in a camp, thousands of people.
Medical service is very limited.
Exactly.
The quality of healthcare is very poor.
From this point, I decide to be in a medical health, in the health field, a medical field, to try give anyone that he doesn't have the chance to have the medical to be that one. So in 2018, I went back to Jordan and I opened my own pharmacy, and I mean to open it in a camp, one of the refugees camp, which is by chance was for Gazi's camp in Jordan. Everybody knows that camp. It's all people there from Gaza, which is Hattin, they call it, or Schneller. And alhamdulillah Rabbil Alameen, I try to do my best. From that point, we are here now.
So your motivation, which I find interesting, is from a personal loss at a young age. This flipped a switch in you where you kind of set out on this mission to want to serve those who didn't have access to such basic things that people often in the West take for granted, such as being able to go see a doctor, being able to get a certain scan, a certain test, these kind of basic services. You wanted to be a part of being able to provide that to people who are dispossessed or underserved and underprivileged.
When you talk about those two people, you talk about father and grandfather. And there is no uncles. That's mean half of my body was killed for these circumstances.
Mm-hmm.
So why? Alhamdulillah Rabbil Alameen, la i'tirad ala hukmillah. But why? These circumstances let me live with 50% of let's see, luxury of life. Those people, our I always say old is gold, right?
Yeah.
So those are the luxury of our life. But I lost 50% of them.
Wow. Especially at a young age.
Yes.
Do you have any personal or direct connection of any kind to Gaza?
Let's say not really from the family, but they're not like they're far.
Okay, so like distant
Yeah,
family.
because in 1948, most of the like there's families go to Jordan, there's families goes to Syria, there's family goes to Gaza.
Yeah.
So from this part, you will find,
because it's important to explain to people who might not be familiar with the Nakba and what happened in 1948 is that people spread out thinking that they were going to come back.
Yeah, because
people they left. Like
I used to ask my grandmother. I told her, "Why you get out? Why you go out?"
Mm-hmm.
I used to fight with
like,
her. Why did you do? She always said,
as if it was
okay,
obvious.
I will say it in Arabic, then I will say it in English. Okay.
Okay, go ahead.
كل ما أسألها ليش طلعتوا يا ستي؟ تحكي لي والله يا ستي إحنا ما طلعنا، طلعونا حكوا لنا بدنا ندخل نحررها ونرجعكم وهينا لهسه بنرجع يا ستي. So in English, she told me that we did not go out by our choice. They told us, the Arabs,
The surrounding Arab regimes or countries.
that go out because we're gonna go inside and bring your homes back and let you go back.
Liberate your village.
But we still going back until now.
Yeah. Yeah, it never happened. And so some people went to Lebanon, some people to Jordan, some people Syria, so all over. There was a big diaspora.
Yeah, some people to Gaza, by the way.
Gaza.
People, they doesn't know that Gaza, more than 50% of people, of the population in Gaza, they're not from Gaza.
Right. They're refugees from somewhere else.
Yeah, the refugees from the surrounding area.
Right.
More than 50%. That's why when people ask me, do you think Gazis will leave Gaza by what's going on there and the plans that Israeli try to make it happen to do the Nakba again with Gaza's people and let them go out of Gaza? I tell them no. Why? Because those people, I asked them and they said, hey, we tried the Nakba one time and we left our houses. We will not try it again. The next Nakba will be to God. In Arabic, next Nakba al qabr.
Yeah. The next Nakba will be the next destination from any kind of violence that displaces people will be to our graves.
Yes.
Essentially is the way it translates. Can you talk to us a little bit about your motivation for volunteering to provide medical assistance or aid to Gaza? So is this at one point it clicks in your head that this is something you want to do? Can you give us a little bit of information about kind of where your path went to actually providing aid, being on a mission to Gaza?
First of all, I was this as a person. I'm like I always saying, I'm a permanent resident American, Jordanian nationality, have the rights and the land and the roots from Palestine, Arabic ethnicity, and my race is Muslim. Don't tell me I mix everything, but this is what I am.
Yeah.
This is what I feel.
Yeah.
All religions are one religion. That's why I don't believe like, I believe that all religions are one religion. That's why. So my motivation was like, I was there one day, not in Gaza, in the situation. And I'm sure there's thousands of people there. They are the same like what my grandfather there. Maybe if he finds somebody to take care of him, maybe he will be survived. Same like my dad. If there is a good medical staff there, maybe they will figure out what's going on with him early
and save the life.
Save people's life. And also, those are my people. And you're gonna add in the top of this, those are human. If this has happened in any place in the world, I will do the same. We swear after we graduate that we're gonna give this science to anybody need it. They did not let us to swear to do it for Muslim or for Arabic people.
Yeah, your oath as a medical professional doesn't restrict you just to one religion, one race, it's universal for all of humankind.
Doesn't matter who is the persons in front of you. So this has happened in one of the states. Do you think I'm not gonna be there? Which has happened something like that in COVID. And I was here. And I did not take any day off.
Yeah. So serving the United States during COVID, the population of the United States, Americans, and understanding that all humans are one, and that any kind of suffering that's happening around the world should have an impact and a reference and a sort of not happen in a vacuum where nobody in the rest of the world listens or pays attention. It sounds like based on that, you decided at some point, I've got to do something, right?
Yes.
And so you wanted to help provide assistance in Gaza. Give people a picture of what it's like to go from that point where you decide you want to do something like that to actually being on the ground there. Give people an idea of what does that involve? How do you prepare yourself mentally, psychologically? financially, emotionally, family-wise? Like, what is that like?
Listen, in the beginning, it will be just an idea. Then after that, we'll start doing what you need to do to let them accept you. Then after that, you go to the another stage, which is to apply. All this until now, mentally and psychologically, it's normal. At the point that they call you, tell you that, hello, you're accepted, and you need to be there at that time. Here, you will start. I'm going to tell you what is most of, I'm not going to tell you about myself only. Now, I'm going to tell you what's going to happen with most of people. Like, I listen from them, like, at the first moment, they start thinking, oh, stop. Now we're not joking. We're going to the place. That's the percentage that maybe you'll come back survive. It's less than the percentage that maybe you're not come back. Because you're not safe. Because nowhere in Gaza is safe. Even the hospital. 37 hospitals in Gaza, they're bombed. 37 hospitals. They're all bombed.
Out of how many total?
Out of 37.
So 37 out of 37, just
Thank
so people
you.
are understanding that.
Yes. And this will start the next part, your family. Like for you, you take the decision because you want to do that. So it's not going to be a big problem with you. Now the other part, which is your family, your wife, your mom, your brothers, sisters, those who's the one gonna start negotiate that with you. Not because they're not wanting to go there, but it's because they're like you're she's your mom.
Yeah, of course.
Whenever, even doesn't matter what are you going, like at the end of the day, after they've finished all trials with me, they said, okay, please, like my wife in the beginning, she refusing 100%, and she start sending my kids for me and do a lot of things. And at the end of the day, when I arrived there and she's believed that there is no choice, she told me, please help them as much as you can. The same like my mom. So it's not easy.
Yeah, because moms, they I don't know about your mom, but my mom sometimes will call me if I just drive like half an hour to go somewhere that's standard. That's like normal part of my life. She'll be like, call me when you get there. I want to make sure you're okay. So going into a active war zone, literally where every hospital, every institution, every building, literally there's no target that's off limits in Gaza. It is definitely going to be something of concern to a family member.
To be honest, the first time I did not tell my mom. Because I know if I told her, she's not going to let me go there. And she's the only one, if she said no, I don't know what I have to, well, I don't know what I'm going to do.
That might be the one person who can stop you.
Yeah.
Yeah.
She knows, you know when? She knows the first time that I've been to Gaza, while after I go out of Gaza, 2 hours after I go out, she's like one of my aunties looks, saw my pictures on social media with the one of my friends there, and she told her that day. She knows. She called me. I told her I'm not in Gaza. I'm in Egypt now. She said, no, you're not. You're a liar. And we'll go from there.
Yeah. So you got exposed that
Yeah.
way. That's how she found. What was the reaction from your family once it was real? So you said that there was a shift to where maybe at the very end they were kind of supporting, saying, if it's this important to you and if you're this committed and stubborn to where you're gonna go, then they start realizing like they better start praying for you, and also wishing you all the best and success as far as the mission itself. Anything else you want to mention around that is memorable?
Actually, they start
Supporting.
like my wife and my mom, she doesn't know I was there in the beginning, but my wife, she said, just give me make sure that you tell me that you're okay ever been a while, and please help them as much as you can.
Mm-hmm. Mm-hmm. And what about psychologically or mentally for you? I mean, I know you said it made it seem easy, like, oh, I just decided I want to go, therefore it's easy. But surely there has to be some kind of, like, I'm just, to be honest, like, I'm a very like deliberate kind of OCD person, oftentimes, and so I would be like doing all my research on, a lot of the details, like what are the chances that I'm going to be okay? What's the daily life going to look like? Or did you just say, throw all that out the window, have faith and just go forward? Like, what was your mental state going into that?
Actually, we was not looking at that part because we are busy in another part, which is okay. We did like a group with the doctors, who's, because it was like exchanging, like there's, let's say, 20 doctors inside, they will go out, and there's another 20 go in.
Okay.
So we did the group between the one who's inside and the one who's coming, so to make sure like the ones who's inside told us before we get inside what is the hospital need from, like let's say
supplies,
a lot of supplies,
sure.
even sometimes, to be honest, devices, supplies, devices, anything that they need, they will send, like let's say
inventory
all
list.
that, all what they need, and we divide it like let's say I know Umar, somebody else knows somebody else, so everyone will bring whatever that they asked him to bring. So I was so busy with that part, especially that you need to know where you're gonna purchase them from. You can't purchase them from here, from the state. You're going from the state, so you can't go out with all these devices through the airport. So you need to take them from Egypt, because they are the last destination for you, and you get them there, and you get inside with them into Gaza. So you need to connect with somebody there, have these supplies, and you only have 24 hours when you arrive, to 48 hours when you arrive to Egypt, to finish all this and pick all your stuff that you have and you need, and finish all these steps. So it was, let me say, I was so busy with that part, so I didn't think about my lifestyle, to be honest.
Mm-hmm. And I'll ask you one more question.
All what I was thinking about, to get inside. Doesn't matter when.
Yeah. I want to ask you one more question about preparing, to kind of set the stage for what we're going to hear, because I want to get into some of the deep stuff for the audience momentarily. But was there a point where you kissed your family goodbye, thinking this could be the last time that I see them, or
without telling them,
kissed your kid
without telling,
without letting them feel it, or no?
Yeah, because he doesn't know if you're coming back or no.
Yeah,
that's for sure.
Yeah.
Like you try to like, I called my wife. I told her what to do. My wife, she's so sensitive, so I didn't go really deep with this. While we are in my way, I think about all this, like, to be honest, while I'm in my way from Cairo to the borderline with Gaza, with this like during those 12 hours, I finished all what you're talking about. Even I talked to people like my friends or brother here, and I told him, hey, like, this need to be finished, this need to be done, this need to be do.
Tying up your loose ends.
Tell my wife that my kids, I need this and this and this. I was with a doctor, the most amazing. Whatever I say will be not enough about him. Dr. Hussam Abdul Hafid. He's Egyptian, Germany doctors. He live in Germany, and he's a consultant and a orthosurgeon. But if I tell you, like, I never met somebody like this doctor in the whole my life. Like, I really teach a lot. Like, they teach me a lot of things, and I like, you got from Gaza a lot of things. They have, like, we went there to help them, but we went out with a lot of things that we thanked them because they gave it to us. We take from them. They didn't take from us.
Yeah.
We learned from them. They was the teachers. And one of them is Dr. Hussam. So he was with me in the bus. And before my sister, the one she's live here in the States, my big sister, she told me, okay, how come you're going there? Are you not giving us any phone number, like, to contact if you didn't answer? Like, I told her, I didn't think about it, but when I get it, I will let you know. So I told Dr. Hassam, this is my sister number. So if anything happened, please call them. And I was on my way back. My family was in Jordan, so it was with me, the stuff for Gaza, and there's 2 bags for my family, there for my kids and my mom as a gift. So I left them with the guy that I purchased all medical supplies. I left them there with him, and I told him, hey, if I come back, I will take it. If I did not, give him to Dr. Hassam. So I told Dr. Hassam, hey, this bag have the whole gift for my kids, and this is for bags I have the whole gift for my mom. So just give it to them.
Wow. So you were thinking for sure that this is a reality that you might not come back.
This is what we're thinking, but when we get inside, this is a different story. I will tell you what Gazis people teach us.
Okay. And I want to get to that in just a second. One last question on the healthcare volunteers that go into Gaza. Are they all the same category of people, or in the same situation as far as resources, who's backing them, kind of, how prepared they are to go into that environment? Or are there different levels and different types of people that are different kind of, I guess based on experience or based on funding, that just get a different experience? Or is everyone pretty much similar?
For sure it's different.
Mm-hmm.
Like, you can't say all of them are similar. That's 100%. But what I can tell you, like, all of them most of them, they come on their own. Like, nobody fund them to come. Nobody pay for it.
That's surprising to me. I didn't know that. So can you explain a little more? So I think that's important for people to know.
Yeah, when I've been there, like in the first time, I was from the state, me and another doctor, and from Germany, one doctor, and 17 or 18, one from Kuwait, and one from Jordan. But we all meet each other in one point, which is Cairo, and we start from there to go. But nobody fund anything. Like, even like, people think that when you leave your job for, because, okay, in the beginning, Israel detect how many days the mission should be stayed and should be leave after 2 weeks, then make it 4 weeks, then make it 6 weeks. So they are the one who detect. So those days, people that think that there's somebody fund you I'm not talking about myself. I'm talking
Yeah.
about doctors.
In general, yeah.
Yeah, like they fund those doctors that nobody fund them for the days that they are leave their clinics, and even the tickets that they purchase them on their own.
So they're basically putting a lot of their own money, their own time and resources towards even making it possible. And then when they go, they're pretty much on their own dime, on their own dollar, right? Is
Yeah.
what it sounds like. I think people have a misconception that it's like Doctors Without Borders, like some kind of like large,
Maybe
everyone has like a large NGO behind them that's well funded. All the logistics are worked out for them. They don't really have to do much in advance. But it sounds like from what you're saying, correct me if I'm wrong, there's a lot of work that you take on yourself to prepare supplies, bring things, logistical coordination. All that stuff is on the people oftentimes
Yes.
who are going.
yes. Even like I know Dr. Hassan Abdette, like he's a plastic surgeon. He's one of the heads of plastic surgeon in the world. Well, what I know, I know that when he comes in the first day in the ward, that he's the one he reserved his ticket. So and he's he's professor, and
So people of very big prominence are doing.
he's very big.
Yeah, they're
And he
booking their
came
own.
with Doctors with No Borders.
Yeah.
And he came and he's the one who purchased his ticket. But the point is, all this, it's nothing compare what Gazis make for us.
Mhm.
It's nothing, really nothing. Like a lot of things that we not everything that you see it, you can say it. Not everything that you feel it, you can say it.
Express it.
Yeah. Whatever you spent, I swear, you need to spend thousands of what you spent to equal one word. You take it from not profession there, no, from one of the kids of Gazis.
The lessons that they give you back, the gift that they give you back in terms of how they treat you and what you witness.
Yeah.
So I want to get into some of that to start us off. My focus is on your first time, because I think that for anyone that can just vaguely imagine what going into Gaza with everything going on there would be like, I think the key question is your first time. What was that shock like? What was that experience like? If you can paint a picture for people, kind of your first impression, first time setting foot there. Take us on a journey with you, what that was like.
It's come on a 3 parts. The first one, which is the first person in my family, 3 generations, all over 3 generations. I'm the first one who get back to Palestine and get inside Palestine. I'm the first one from all my family. None of them take this chance to get inside Palestine.
So since 1948, you were the first one to set foot back
3
in
generations.
Palestine. So that had its own weight.
Yeah. The second one, the feeling that you got when you get inside, it's different. Something different, totally different. Don't tell me how, don't tell me why. I don't know. But the peace and the coldness that you feel when you get inside the border, you don't feel it anywhere in this earth. And I swear to God, I never felt that much of peace and no stress at all more than while I'm in Gaza.
Hmm. What do you think that is?
Some people, they ask me, even when you've been to Mecca? I said, even when I've been to Al-Medina and Qabr Rasul Salam, which is the Rasul Salam, he said, our prophet, that the Medina, he prayed for the Medina peoples to be in a safe place. I didn't feel what I feel in Gaza. You know, when you get worried from something like for long time ago, and you find out that you are past it, how you feel?
Hmm. Relief.
This is what you feel when you get inside
Ultimate,
this.
ultimate relief.
Yeah. 100%. The third part, which is, I'm talking about myself, like from how much I was happy there. Some days for sure was a lot of work, but I used to say from how much I was happy there. Some days I forgot even to text my wife. I forgot. I was so happy.
Where do you think that comes from? Do you think, I mean, my interpretation of what you're saying, thinking about it from my perspective, would be, I think the entire collective human conscience right now has been tested to its limit in terms of what people are willing to witness on their phones and in reality what they know is going on, and to not be able to stop it, to not be able to stop what's happening over there to people, human beings who are humans just like we are. I imagine there's a great sense of, I'm no longer guilty of being a quiet bystander who just sits back while a certain group of humanity is being killed in such a horrific way over such an extended period of time, live stream on the internet. Is that part of it? Is that a large part of that feeling of,
For me,
is guilt relief part of it, I guess, is my question.
maybe maybe we'll talk about this later on, but for me, no.
Okay.
It was from how much those people there in Gaza, they're different, man.
Mm.
Different on all subjects. Like everything. They're nice people. They are love to give. I didn't see people love to give like people in Gaza. They love, like, I have a couple gifts with me when I've been there to doctors. I was telling people the gift passed 4 or 5 doctors until one of them accepted. Because I gave it to Omar, and Omar said, Allah, no need, Ibrahim. You know, I have one. Muhammad doesn't have one. Give it to Muhammad. You can imagine how much those people.
Just selflessness.
Yeah. They are so rich. Not money wise, ethical wise. The ethics there, you never find it anywhere, even from a humanity part or a religion part. So I will give you example. When we get inside, the first thing that they did for us, they take us to, like, it's a big house. Let's say it's a villa, let's say a big house.
Like a compound?
No, it's one house. It's a big one. It's a luxury one. It used to be luxury. It used to be in Rafah. Now it's not there anymore. And they bring food And at that time, there was no food. Gazis people, they are famous with one tradition plate, they call it fette, which is rice with the bread and the meat soup, and on the top for they will put the meat. It's like mansaf, but without you will take off the yogurt. There's no yogurt. They put it on the side instead of the yogurt spices. From that point, you look to people of Gaza there, sit with us on there. The first lesson that I took there wasn't the first moment I get inside. They didn't told us, teach us, but like that circumstances and the situation and the atmosphere that you are in teach you that you doesn't have to eat. You don't have to eat until you as a person get full. No. You need to eat what make you survive. And let's say you need to see the plate and see how many people with you and imagine your part and detect it and eat it, and don't eat more than this. They used to have the spoon. You know why you're eating? If you're talking, you don't eat. The one who's talking, he's the least one. The least one eat. Who's the one more talking a lot, right?
Yeah.
They used to hold the spoon with rice and meat and talk most of the time. You know why?
So they get their portion?
No.
Why?
To leave you eat, and to make sure that if you told them that you're not eating, to tell you, here you go, I'm eating. But to make sure that you eat as much as you want.
So there's a constant awareness of the fact that there is not enough. There's a constant awareness of that fact and a constant adjustment in how people do things, how people utilize things, how people consume things to make sure that there's room for others and there's enough for everyone.
Do you know how much
it's baked into the psychology?
It was like nobody have meat at that time there. They bring it for us. They are in a war, and we are there just to help them, and they welcome us in a way that's, I promise you, if you go to any other place, and they does not have a war and have nothing, they will not welcome you as much as they welcome you.
And was that part of your first experience?
This is the first day that I get inside. Then after that, they have I told you that this house, the doctors should be there, to sleep there. They went to the hospital in the morning, and they went back, let's say 6, 7, 5, depends, because they are, that the organization will make sure that they move with the bus, that this bus is known for Israel, and move within a certain time, and blah blah blah. So me and Dr. Hussam, the one I told you about, Dr. Hussam Abdul Hafiz, we refused to stay there. And I told them, hey, listen, for me, I'm not staying here. So he told me, don't worry, we're not gonna stay here, because he used to come before, so he know. He told me, don't worry. Then we told the guy, the one who is responsible about to take about us there in Gaza. Let's say that the person who's the manager of the organization that from inside Gaza. I told him I need to go to the hospital. So he said, why? I said, I'm not coming here to sleep in the houses. I need to sleep. Where's the doctor sleep? He said, no, you can stay in here. Here's this safer to you. And I said, no, I'm not coming here to stay in a safe place. We need to go to the hospital. He said, okay, tomorrow morning we'll take you to the hospital. I said, no, I need to go now. He said, I can't. Because like there's a lot, the atmosphere now is not good. There's a lot of tanks around us, and we're not organized this movement with the other part. We did not organize it, so we would.
It's not coordinated. So he was afraid that there could be targeting and you could end up getting killed on your way.
Most probably.
And this was, just to be clear, we didn't talk about this, was spring 2024. You mentioned right, your first visit.
Yeah.
So just to give people context of what time.
Yeah.
Okay.
And at that time I told him, please, I want to stay here. I don't care, but I can't. I can't. So he just told the guys to prepare the cars, and they took us, me and Dr. Hussam, to the European hospital, where I met the doctor for the first time, Ahmed Abu Nadda. He's the head of vascular surgeon in Gaza. And by the way, he's Germany's too. I have a Germany citizen.
German citizenship and
yeah.
certification.
Yeah. He took us to his room, and you can take from there this like he head of vascular surgeon for whole Gaza, Germany's citizen, and graduated from Germany, and the science that he do have in his mind, I swear to God, it's a triple what the anyone in his position have it. And if you want to meet a doctor with this situation here in the state, you need to take an appointment 3 to 6 months before. When he take me to his room, which is this is my first time I saw him, but he's Dr. Hassan's friend. They study together. So guess the room, there is 2 beds, and there's 3 mattresses on the floor. He slept on the floor, and he asked me to sleep on the bed, his bed. Think about it. This a huge science move. Ask me to sleep in his bed, and he will sleep on the floor. And in the beginning, I said, I'm not. There is a small balcony with the room, so it's inside the hospital. It's like it's one of the hospital building. So I sat down in the chair in the balcony. I told him, doctor, I'm not. Even if I'm gonna sleep on this chair, I'm not. From this time, I know how much Gaza's people, they are persistent.
And you're also saying you're talking
because
about,
he told me
he's probably exhausted at that point.
He told me,
he's working.
even if you sleep on the chair, I'm gonna sleep here.
Yeah.
And he left me, and I will end up sleeping on the bed.
And he's someone who's exhausted at this point. He's been working back to back 24 hours. God knows how many, how much sleep he actually gets. And
he's been more than 4 to 5 months continuous working.
Yeah.
No back home.
Right. Talk to me more about kind of what your initial experiences were. So you get in there and you start working. Take me to like maybe some of your first noteworthy items that pop up in your head as being like crazy on the registering as far as, something you saw or cases of patients that what was it like just getting acclimated to working in the hospital? I guess I should ask. So, you walk in there, I'm sure there's limited supplies. It's way different than working in a hospital anywhere else you've been up to that point. What are some things you immediately start to do to try to acclimate, to get yourself plugged in to the day-to-day working of the hospital?
There's a guideline to work on. Like there's steps you need to take while you are take caring of the patients. Over there's no rules in Gaza. You need to work with what you have. Like sometimes there is no gloves, and one day there is no head cover in the procedures room. In European hospital, they used to have when the patient have a big wound in his body, we need to put him on a suction device, and every patient should have his own suction device. But there is no that much luxury of to have every patient to have a a, a
Their own
device for
device.
himself, because the patient, there are double what they used to have, so they connect all patients with the central section that they use it for not this purpose, but this is the only way that they have. So we try to make a unit and for suction and for wound care, and Nasser Hospital and Al-Aqsa, and Shahada Al-Aqsa Hospital and the European Hospital. And a lot of people I should thank in this part. There was the reason, like friends from Texas. We're not organization. So there I have a friend from Texas. I should thank him. His name Ahmed Sharif. I know he's gonna get mad because I say his name, but I don't care. I like Rasul Alayhi Salam. He said, "No, الفضل يجب أن ينسب إلى أهله."
Mhm.
The good indeed should be
Returned to its rightful owner.
exactly.
Yeah.
So he and his friends, because there was a lot of things, they bring almost 12 suctions devices, and I took them with me. They paid for it in Gaza and no, Egypt, and I took them with me inside, and I made those all 3 units. It was really hard. In the first day, Dr. Ahmed, he teach me everything.
Like he translated for you how to work in that environment.
This is it's a different.
Mm-hmm.
Even in the first day, I remember when I was there, we work in the floors, because we are all the day we will be in the procedure room. We were, because I work with the vascular surgeon, so we will be me and the vascular surgeon, another vascular surgeon, another nurses and helper and anesthesia inside the room. So we always inside this room. But the system there, when there's a new bump happen, so everybody knows that there is bumped on this place. When I'm telling you bumped, that's not bumped for one person. Bumped, that's mean, I don't know the numbers, but I'm telling you, like, there are more than 20, 30 maybe. I don't know. I'm not like, I don't have experience in that, but they know more than us. Like the kids there, they know if this sounds, the kids there in Gaza, when they hear the sound of the bomb, they know if this is bombed from tank or this is bomb from F-16 or
Mhm.
F-18.
They can discern
Yeah.
the different kind of
Yeah.
ordnance that's
Yeah.
going off.
Yeah, keep it in your mind.
Yeah.
Are those kids, should we learn these things?
No.
For that part, they are experienced at that level.
Mhm.
When I asked, they said, yeah, this like kid, if he's 10 years old, that's mean he watched at least 6-7 wars. So when they pump a place, that mean they pump a square. Like it will be like 20 racks between each one and the other, let's say seconds. Okay? And you will go, not you, I mean, when the ambulances go to that place, let's say this is a square of area, because all squares, most of the time the squares are the same families. Okay, let's say the square we are talking about, when we're talking about squares, because the buildings there, they're close to each other.
Yeah.
You will see 5-6 floors, and the 5-6 floors are like there is no more than 5 feet between each, less than 5 feet sometimes it's like
Touching
each other.
Yeah.
So when you talk about square, you talk about at least 10 to 15 building, sometimes 8 building. 8 buildings at one time, there will be
Brought down.
nothing.
Completely leveled.
Nothing.
In one square block.
Yeah. So when we got this announcement.
So hold on. So in one square block, there could be 8 buildings.
There could be 12.
Could be 12.
Yeah.
Roughly how many people would live in 8 to 12 buildings?
No, you talk about hundreds.
Hundreds of people.
Yeah.
Killed or seriously injured, if the ones who were lucky enough to survive.
Either killed, either lost, or either injured.
Yeah. In that one bombing.
Yeah. And when we get this announcement, that's mean the whole hospital, like with all categories, nurses, wound care, doctors, professionals, emergency, whatever you are, doesn't matter what is your professionality. You will see them all together, standing by the door of the emergency room as a line.
To receive the wounded.
And they're not enough. Because when you receive like 50 or hundreds or 150 of injured.
Severe cases.
I'm telling you 150 injured, not because they are 150s, no. But like you as a hospital got 150. There is another hospital got the same number. So when you got this amount of people injured, you will see the floor full. The floor.
Of what?
Of patients injured. The blood is everywhere. The first day I saw this, which is all floor filled of injured people, 75% of them women and kids, I get shocked.
Like you actually saw it with your own eyes. Now it's reality.
Yeah. Dr. Ahmed told me, Ibrahim, this is not the time to think. This is time to work, and we will think when we go back to Rome. Let's go. And I start. Don't tell me what, because it's a lot. When you see kids headless, and let's say by chance her dad He was out of the square because he's going to bring stuff to feed them, and he come back and he didn't find anybody from his family alive. But when he's coming back to the hospital to figure out if his kid here, and he found a body headless on the floor, and he said, I know this is my daughter. I know her from her jacket. It's a lot.
So
And he hold the body,
Mm.
headless body, and say, Alhamdulillah, thank you, thanks God. When I saw this, it's the, like the only and the right thing to say about those people are one thing. 360 kilometer, small spot. You can see it by your eyes on the map. Teach the word. What does thanks God mean? What does La ilaha illallah mean? What does patience mean? When you're working as a doctor in the emergency room and you're receiving your family while you are doesn't know that they're family. When Dr. Ala al-Najjar, he was in the hospital working, and they told her, your square is bombed. And she ran to see what's going on there and come back with 9 kids out of 10 dead. And she could not differentiate in the beginning between her children's, because they're burned totally. Not first or second or third degree. No. You see black bodies. 9. She hold them. Hold the 9 people. 9 kids. Out of 10. And her husband and the youngest kids, they're both in the ICU. Then her sister, just for your information, Dr. Ala al-Najjar, she's pediatric. And she's memorizing the Holy Quran. And 3 of her kids memorizing the Holy Quran. She come at the place that we will put the bodies. And she saw like only 9 bodies. Put it in a white
wrapping or shroud.
and hold them on the floor and say Alhamdulillah. And her sister told her, Allah, they're all dead. Her sister. And she said back to her sister, no. أحياء عند ربهم يرزقون. Where are you gonna find people like that?
Mm.
Then the next day her husband dead. Where are you gonna find people like that? One day we are in the round in the morning round. Doctors in the morning doing round for people that we did surgery for them in the day before, check on them. And one of the doctors, Dr. Muhammad, I can't remember his name. He was with us. And they told him, hey doctor, your sister's house is bombed. He said, La hawla wa la quwwata illa billah, inna lillahi wa inna ilayhi raji'un. Then he wanted to complete the round with us. So they told him, man, just go check your sister. One of the doctors told him, go check your sister. And he said, no, don't worry, we'll complete the round first. Let's complete the round, then we'll see, we'll figure it out. He said, no man, we're not completing the round, just go check your sister. And they keep arguing for 5 minutes. Then at the end, the doctor told him, I can't leave. He said, why? He told us, man, أنا على ثغر. I'm in a place that I promised God that I will be here helping people. I can't leave. And he told him, man, just leave and I will cover you until you come back. He left. And the nurse told us, this doctor, he lost 83% from his family, 36 from the first circle, which is dad, mother, wife, kids. And he's still standing and working in the hospital. Another doctor, while we are in the room, just sitting and talking, and one of the doctors, I asked him, if the war stopped right now, what do you wish to do? He said, just to go take my brother and his family bones and
give them a proper burial.
I said, well, he said, yeah, because their house is close to the Shifa hospital. And when they go inside the hospital, they start going inside. The house is surrounded by tanks and kill everybody inside. Doesn't matter, kids, women, and men. They're all killed inside. And they stay inside killed because the army is still there and nobody can reach that area.
Can I ask you a question? Just to pause a little bit. So what is the toll? Obviously, we can kind of get a sense of what these doctors are going through just from what you've already described. But what is it has to have an impact on their ability to work. I mean, most people would say, how are these doctors still doing their jobs? How are these doctors still standing? How are they, give people an idea of what the shift is like for a doctor, how many patients they might see within 10 hours, 8 hours. Give us some sense of the volume of what they're dealing with and how they're dealing with it just to keep moving day after day after day.
They teach us that in the first day that we went there. Okay, the first thing that you need to do, let's start backward. which is from that moment that you put your head on the bed, on your pillow. The first thing that you need to say a shahada, because maybe you will wake up, maybe not.
Maybe you won't wake up.
Yeah, because there doesn't differentiate between hospitals and houses. All is bombed. So say shahada to make sure if you dead that you did like you. At least you said shahada before you die.
And for those who don't know what shahada is, for Muslims, this means saying your last rites, essentially, saying that you only worship one God and that you essentially, you're preparing yourself for death. This is kind of like the Muslim version of last rites for Christian audience.
The best thing that to say it before you die.
Mm-hmm.
And when you wake up to pray Fajr, you say Alhamdulillah because you are still alive. But when you go to the bathroom, one moment, you need to finish quickly. You don't have to. You should not take that much time inside the bathroom. Not because the long line, that's okay. But because maybe you get bombed while you are inside the hospital in the bathroom, and you don't want to be bombed while you are naked.
Mm. In that situation, compromised situation.
Yeah.
Yeah.
Then after that, you start your day, but we don't count because you will like the first day I was with Dr. Ahmed Abu Nada. Dr. Ahmed Abu Nada, he was seeing patients in the room, patients in the on the stairs, patients on the way while walking to the emergency, patient like everybody. That doctor, just can you see this? Can you see that? Can you see this? Can you see that?
How many patients would be to one doctor? What would you estimate is the ratio? Is
High.
one doctor dealing with 50 in one shift?
Oh, more.
How many?
A lot.
Ballpark, if you had to guess.
Surgeries or emergency or
Let's say surgery, emergency, like life-threatening, serious.
Emergency. There's it's not numbers of doctor because there is a four procedures room. So the ortho, they have one. Let's say vascular have one. So there is a priority. Okay, priority depends what is the most thing important to take for the patient right now.
Triage it.
Exactly. So it's not numbers, but what I see that I'm not gonna talk about myself. They stay working until the reach the limit, not numbers of the patients, because number of patients didn't stop.
Doesn't end.
No, you bring like bombed is all the day, so you're receiving patients all the day. Even the patients that you did surgeries for them, they have
follow-up needs.
And there's sometimes like spending 4 hours in a procedure to save one leg for one patient, and after 1 week you will come back, do amputation for the same patient that you're spending 4 hours to save the legs, because there is no wound care to take care of his legs. So when you open the wound to say here, like you will see something that you never see before, and so you will do amputation.
So the doctor works until they basically can't.
This is what I wasn't going to say. I was going to say the limit to the number of patients that they see until
they collapse.
They can't stand up anymore.
And then get a little bit of sleep, and then
because they get inside the procedures room, and they don't go out until the time that they're not. They go out to pray. They go out to pray, and they come back, or bathroom. That's it.
Does someone feed them sometimes while they're working?
Like Dr. Hussam, he's one of the people that I never seen before. I love him so much. This doctor, he get inside the procedure room at 8, 7. He keep working until 9 p.m. non-stop. They they bring food for us. They put it in the room. He don't go outside the procedure room to eat it. He stay inside. And whatever, Gazis people, they don't left their places. But whatever those people, the nurse, like when you talk about Dr. Sam, you talk about consultant of the consultants. And he's inside the procedure room, whatever the people there inside this area, which is not doctors, because doctors goes outside eat. But this doctor, he stay with the Gazis doctor, to be specific. So whatever those people eat, which is people, nurses, triage, the people clean, all of them, whatever they eat, he eats sandwiches while he's standing between, he just finished patient and he's waiting for the other patient to do anesthesia for him. Between that time, he eats a sandwich. That's it. And when he finished, he comes to the room, because we are staying in the same room, and whatever we have in the room, he eat. If you don't have, he sleep. One day, they make food for us. We are 7 people.
Beans. So
yeah.
For those who don't know.
Well, 7 people, so they make 1 beans
can.
And that time we need lemon. There is no lemon. So I told Dr. Ahmed, let me go. There's like a small, let's say, small place. They sell whatever they have. I went, me and Dr. Dawood Borde. He's a vascular surgeon too, from Gaza, from Jabalia. And we went there to get a lemon. The 1 piece of lemon, it's $10. $10 there is the number.
Yeah.
You talk about
people on average make
40 shekel.
Yeah, people on average over there in Gaza, would you say even prior to the war, they make $300 a month?
400.
400. That's what their family's living off of.
When you buy 1 lemon for $10.
Yeah.
And same thing. When you go back to the room, you will see with those doctors the Quran ayat. I swear, they show you what Quran, some ayah, mean in a practical way. يطعمون الطعام على حبه مسكينا ويتيما وأسيرا. They need the food and they don't eat it. They feed it for the people. Those people, and I'm going to say it in Arabic because it's for them, to let everybody understand what I'm saying. أهل غزة عندهم عزة وكرامة بتتوزع على الكرة الأرضية، وأنا أقسم بالله العظيم وأنا شاهد بعيان، كنت هناك، إني لم أرى في حياتي عزة نفس أو كرامة أو كرم أو شهامة أو نخوة أو دين أو أخلاق كما رأيت في غزة، والذي رفع السماء بلا عمد، أني تعلمت من صغيرهم قبل كبيرهم. I swear to God.
Try to translate it in English. It's hard, but I'm going to try my best to give people, a Western audience, an understanding of what you're trying to say. essentially what he's said is that from what he witnessed, he hasn't, the people of Gaza have dignity and honor and distinction and grace and humanity that you could spread over the entire globe and it would cover it, enough to cover the entire globe. And that he's never seen anything like it in his life, and that he's learned lessons of wisdom and spirituality and depth from children, just as much as from adults. There's that much unique circumstance going on there.
11 years old kids memorizing the Holy Quran. His name is Hamza. And around, he got shrapnel in the area between the testis and the leg, which is a lot of pain in that area. Related, there is a lot of nerves at that point.
In the groin area.
Yeah. So we need to clean it. But there is no anesthesia. He was there with his dad. Do you know the stories that they used to tell us about Sahaba while we are kids in the school?
Mm-hmm.
Yeah, we saw it there. When this kid that he holy memorizing the Holy Quran, and he told us, hey, since there is no anesthesia, when I start reading Quran, just to clean it.
What did you have to do? You were amputating his leg?
No, we just cleaned it.
Removing the shrapnel.
Yeah. Clean the one.
Yeah.
And for who doesn't know that, in some point and in certain times they start cleaning the wound, mixing the vinegar with the dish soap.
That's what they use there in Gaza?
Yeah, since you reached the time that you doesn't have anything inside the...
What would normally be used under normal hospital circumstances for that?
You should use antibacterial. You should use the hydroxy peroxide to clean it.
And so you guys resorted to using dish soap and vinegar mixed together.
Mix it together to clean the one. And this painful as much as you can. Painful as much as you can believe. It's
with no anesthesia.
Yeah. When you know at this circumstances, everybody cried, like the patient and the doctor and the dad and the mom. And now they are starving. Now they are dead without because there is no food. And everybody just look at them. We just look. We don't do anything. Where is the humanity? Where is the rights? Don't believe what you listen to. What you seeing in the news, this is 10% from what you're gonna see over there, because they can't show you everything. I promise you, whatever you watch on the news, it's a 10%.
Can we touch on something quickly? In your view, what are some of the things that people don't realize are happening there that they've been given the wrong impression in the news? Like things that the news is saying this, but you've seen with your own eyes and you've witnessed with your own hands the opposite or something different.
Do you remember when they start throwing the food from the airplanes? Not this time, last time? Yeah?
Yeah.
And they start saying, oh, there's a lot of food, and there's food, and there's food. Whatever they throw from the airplane, it's a small truck. Gaza's people, they need 600 trucks before the war. The 18 wheels truck. They need 600. Those are 2.5 million people. Do you want to throw for them a couple boxes from the sky and tell them, "Hey, feed yourself"? What are you doing? Are you just showing the people that you're doing the right thing? You're not.
It's a photo.
This is a game.
It's a propaganda photo op.
Yeah, there's a strike because they know that they start look for all over the world that they are doing crimes, and this is they are just letting the civilians to be starving. This is a genocide.
And you've seen this with your own eyes. I want to just clarify. We mentioned that spring 2024, you were there. You were also there recently as well. So you have a sense of how much things have changed and the famine and starvation aspect.
Even
as well.
until now, because I'm connected with the doctors, even in the north or in the south.
Yeah.
Every day, like I talk with them, and I like. Sometimes with the doctors in the north, sometimes with the doctor in the south, and I have an image about like what's going on there, and I know doctors there are starving. Doctors there are lying now, falling down in the procedure room. Doctors, not patients, because they've been 3 days without food, and they just take one normal saline by IV.
They take saline by IV.
Yeah, normal saline.
In order to continue functioning.
Yeah, instead of the food, there's no food.
Doctors. This is doctors who
Yeah,
are
doctors. Yeah, doctors. They take it. They drink water with salt, with sea salt. They mix them together and they drink it
for electrolytes.
Yeah, just to make sure that they are not going to dehydrate.
And you've been there recently, as recent as months ago, would you say?
Months.
Yeah. And so you have a very clear picture of famine, because that has been going on for a while now. That's why I'm bringing this up. And so how is it that people still have this idea that famine is a lie? I'm sure you've seen it. People keep repeating this in the West, in America. It's unbelievable, and it just shocks me. Saying that, oh, no one's starving. It's all just propaganda. It's all just bullshit. What do you say to that from what you've been in contact with people on the ground, operating in operating theaters, in hospitals, in clinics, trying to do the best with all the circumstances and picture you painted of what it's like to be a healthcare worker in that environment? What do you know to be the truth?
Okay, let me talk to those people. If they now, I'm not gonna tell you they are been under attack 600 over than 600 days. No, if they're now, tell any one of them, stay at your house and don't move, and nobody will get in touch with you, and you're gonna stay in your house, you and all your blocks, like let's say one block, okay?
Your neighborhood.
All your neighborhood, nobody gonna goes out, nobody gonna goes in, no food, no water, no electricity, no nothing. Okay? And I'm gonna drop you from the sky 2 boxes to eat, guys, okay? For the whole neighbor. Do I'm feeding you or do I'm doing propaganda? Who's doing the propaganda? This is the first thing. The second thing I'm gonna tell these people, that just to let them know, Gaza's people, after they reach point that there's no food, there's no flour, okay, what they did is they ground the animals' food, the animals' seeds to do bread from those. And after it's finished, they start eating, bringing any leaves, doesn't matter what this tree is, and eat it.
So they're eating animal feed and leaves off trees.
They finished. Then no more. And then there's no more animal feeds there now.
Yeah.
That's why you're gonna see the dogs eating the human bodies. I think those people, they see in this picture. How it's propaganda while you are 3 months in the same place, nobody get inside, nobody go outside, and no food, no electricity, no water? How? Let me tell you something. When I was there, my lips start bleeding because the water what we using, it's from the sea and it's salty. Salty for a level that you are on the second day your lips, because when you do wudu, and the second day you will start bleed. I swear while you are in Gaza, you're gonna be wish cup of water, not salty, not food.
So if the healthcare workers are starving, like to me, that's if I'm trying to paint a picture to a Western audience, an American audience, who are just now starting to focus, social media is starting to pick up more and more. You saw Tucker Carlson, he had a very famous interview that went viral just yesterday and today, in which a U.S. Green Beret, 25-year veteran, Tony Aguilar, was giving basically his firsthand account of what he's been seeing in some of the food distribution site messes and killings that have been happening. He basically is describing that there is hunger going on. He's seen it with his own eyes. Don't believe the propaganda that it's not, etc. To me, what you're saying is even more critical or convincing, because usually, correct me if I'm wrong, in that setting, doctors are prioritized so that they can continue treating patients and rescuing and saving lives. And so if doctors themselves are not getting enough food, or not getting enough water, or not getting enough nutrients, what about the person who's not as valuable? Meaning the person who doesn't have a profession that's as critical. Someone who's just your average person, they have no work,
Omar,
they have no food, no water. Their ability to get food and water, to me, is even harder than someone who's a highly trained doctor.
add at the top of this, Omar, when we make a procedure for hours to save someone's life, this patient need food to make sure that his wound doesn't get infected, right? Those patients, they come back to the procedure room to do amputation because they're not eating.
So people are losing their limbs because of their malnutrition.
Yeah, there's no food. There is no food. What they're doing now, this what they are knowing now, which is the food that they are trying to uh, throw it from the sky in a non in a not it's in a not humanity way. Why are you throwing the food from the sky? You have 5 borders. Why are you throwing the food from the sky? Tell me. The UN telling you that we have food over there by the stores on the border. It's enough for 2.45 million for 3 months. Why you doesn't let them to get inside? What is the food when you throw it from the sky? They go for the right person, and if you get it from the border, will go for the right person. That doesn't make sense. This is a propaganda. And all food, just to let you know, that they throw it in from the sky, they goes inside the areas that there is a lot of tanks and a lot of Israeli soldiers, and nobody can go there and get this food.
So it's collective punishment. It's collective starvation of the population
Yes.
that's going on.
And just to let you know, if the people, like, this is happened after the people in Europe and in the States, the community, after they start moving and they start saying, and then they start talking about, this is not should not happen in the 2025. What are you doing, guys? Like, what is the humanity? Where after they start this saying, and after the couple countries they start talking about the in Europe that they will be changing some couple things with Israel. After all this happened, Israel start doing this propaganda to throw a couple boxes from the sky to show people that, oh, we're feeding the family. Man, go see their bodies. Their skeletal muscles. Now, all that. They're losing 60 and 70 pounds from their body. The infants and the kids, it's 150 people dead from starving. What is the propaganda? What is the propaganda? 150 people dead from the starving. Kids. There is more. I just told you 3,156 mom.
Miscarried.
But yeah, from what?
Malnutrition.
There's no food. It's not mal. From non-nutrition.
Mm.
It's not mal. It's non-nutrition. What? This is what you're watching on the TV from people saying that we are starving 10% from what over there. If you've seen in your eyes what is the starving mean there, you will not believe it. The press of TVs, they drink water and salt. They have no food. People falling down in the street. No food. This is genocide.
There's something I want to say here too, Ibraheem, if I may. Something that I want people just to think about for a second, okay? There could be people listening to this who are completely, on the side of Israel in terms of pretty much carte blanche. Give Israel any trust, call it concede any kind of propaganda that Israel's put out as being the truth, those kind of people. And there could be people listening who are on the other side of the spectrum. 100% they understand and believe that this is actually lies and propaganda. And in fact, what's happening with the Palestinian side is saying is actually true. What I want people just to listen and hear, just one moment, please, just one moment, is you cannot possibly believe that doctors and healthcare workers are making up stories and are inventing complete fiction and think that is plausible compared to a government that has a vested interest that has been hell-bent on taking over more and more land from another people, having the opportunity to get this done on their watch, under this current regime, under Netanyahu's government. You can't tell me that one side is more believable than the other and say that it's Israel. In this situation, they have everything to gain by lying and by putting out propaganda and saying that there is no starvation. And they have everything to gain in terms of their political objectives, military objectives. And on the Palestinian side, we're not asking you to take the words from some kind of Hamas spokesperson. We're asking you to take the words from healthcare workers, international community healthcare workers who are operating in circumstances in which they are running out of food themselves. I just want people to understand that. You have to think about that critically for a moment and ask yourself, which side seems more plausible? I'm sorry, I didn't mean to cut you off, but I just want to make sure that people think about this critically.
You're right. And if you go back for the beginning of the war, do you remember when they are starting a big and the head of the not social media, TVs channels start talking about cutting heads and blah blah blah. They coming back and say sorry. This is no proof. There's no proof for that.
Yeah, the 40 beheaded babies.
Yeah,
that whole.
Same.
The White House even had to retract it.
Yeah,
quietly. They didn't retract
There's
it.
No truth.
Loudly.
This is the propaganda.
Yeah.
This is what tells you who's the one who lied and who's the one saying the truth.
There's even, did you see this? I don't know if you followed this, but that Tony Aguilar, the one I was talking about, he was the guy, he's a Green Beret military guy. He was on Tucker Carlson just the last day or so. And he said that when he came out telling the story of how there's starvation, there's targeted basically killings happening on these food distribution sites, people using IDF using live ammo against civilians that are lining up for food. Sometimes the killings are intentional. He didn't see anything that he wouldn't go as far as saying that they were intentional. He looked at it more as like neglect or bad training or whatever you want to call it, which I would even contest that, just understanding how many reports are coming out of the area. But what I'm trying to say here, what I'm trying to bring up is that Tony Aguilar, because he came out and he was a very credible person because he's a U.S. military guy.
Yes.
Loyal, patriotic American, 25 years. He just retired and then he's volunteered to go to help stuff in Gaza from his perspective. He said that the Israelis, or someone working on behalf of the Israeli government probably, tried to discredit him he gave a story that moved a lot of people in America, went viral online, of a young boy who came up to him and he held his hand and he put his hands on his face and he said, thank you for giving him some food. And this boy was later found dead. Tony said that he saw him dead later. He was killed just within the last few days, maybe within the last week or few weeks maximum. And the Israelis put out propaganda in the form of a picture showing Tony Aguilar with another boy, saying that that same boy was the boy in the picture and that he was alive 2 days later, trying to discredit it.
Yeah.
When he said that in the Tucker Carlson interview, he said, I was the one who took the other picture. So Tony took the other picture, and that was on a different food distribution site multiple days before the incident with the boy who was killed. So my point is I want people to think about it. If the Israeli government or whoever is responsible for doing that, which probably had either their direct involvement or their indirect involvement, if they're willing to use a lie of taking a guy's picture that he took and saying that it was the same boy, and it wasn't, you can tell by the boy, he looks different. And the guy comes out and says, I took that picture and it was days before that boy was killed. What lies do you think they're willing to put out in order to justify this war? That's my question to people.
And
so
they get out. If you did remember, they bring like a bags with the weapons that comes out from behind the CT scan device.
Yeah.
Which is just the CT scan device. If there is any metal around it, it doesn't work.
Right.
It's not.
Right.
So you can't. Like anybody go to take a CT scan, the first thing that they told them, if you have anything metal, take it out.
Yeah. Right.
They bring behind.
Someone just died in the news. Remember, like a guy got sucked into a machine. It was in because he had metal or a necklace.
And they get out like they just make a video with the handbag, like maybe 15 M16 come from behind the CT scan.
Yeah.
Like
people don't understand how much the lying is.
How about the 36 hospitals? Okay, Shifa. Okay, how about the other 36 hospitals? There is no places in Gaza. The only place that they have to hide the weapons is the hospitals.
Yeah.
That doesn't make sense.
Yeah.
They know they are the same of our traditional quote that says بكذبوا الكذبة وبصدقوها. وبيحاولوا يقنعوك فيها.
They believe their own lies and they try to convince you of their own lies.
Yeah,
that they know are true.
Yeah.
That they know are bullshit, but somehow believe.
Yes.
I don't think people are ready for this.
Why are we gonna go so far? It's yesterday. President Trump come out and he said that
people are starving.
They're starving, and my wife, she watched the pictures that she never watched it before, and he said we need to feed the people. Like people, they're starving. He's doing propaganda too.
Right. I just what I'm trying to get at, Ibraheem, is people need to think critically and understand that they are being lied to directly to their faces. These Israeli politicians, they are versed in how to present to a Western audience. Like I've seen it since I was younger, paying attention to politics and stuff. You see, like if people go online and there's a lot of people putting out videos of what the Israeli politicians say in Hebrew in in Israel is way different than when Benjamin Netanyahu comes on CNN or Fox News and gives an interview. And the way that the Israeli politicians talk in the Knesset and in Israel on Israeli TV in Hebrew is way different than what they come to the United States and say on a popular news program.
That's
they
why
know
you'll never see him talk in English and in Hebrew in the same way.
Yeah.
He have a Hebrew talking for
persona.
Israeli people,
Yeah.
and they have English talking.
English persona.
They prepare it for American, especially by the way, for American communication community.
Right.
Especially for American community.
Right.
They get shocked from the study comes yesterday, the day before, from here, the United States. 52% of the community in the United States, they said that Netanyahu's wrong. They don't like him. Which is this number never happened.
And the number is huge if you see
this number didn't happen since of 1997.
Yeah. I saw the Democrats, they were showing there's like his approval rating was like 10 or 15%. His approval rating among Democrats was like 80 or 90% around October 7th, either shortly after or on October 7th, around that time. And then they showed his approval rating now with Democrats is like 10 or 15%.
Yes.
And with Republicans, huge loss of ground. People are so fed up and sick of the lies. I think not enough people know yet, but more and more people know.
And today, if you watch the news in New York, did you see the Jewish people there?
I missed it.
They're doing a stand in the New York, Manhattan, and they have a sign said that war should stop. Cut funding Israel with weapons. The Jewish people.
Yeah.
What happened in Palestine is a genocide. Stop killing Palestinians. Because this is a humanity. We all humans.
Yeah.
But some people doing. By the way, they have. I keep saying like Israel, either the one who's holding the monitor for their videos is not good enough, or they have bad luck with their lies. They always, when they lie, after just a couple days, couple weeks, something comes out, shows that they are liars.
Yeah.
Every time.
Well, I think part of it has to be, I've thought about that. Like, is it because they're that incapable or incompetent as far as the people putting out this information? Or is it, what's the reason for it being so easy to kind of see through or disassemble for the public eventually online? I think it's two things. One, you have a group of very dedicated activists online who are hell-bent on trying to expose things as being lies. And number two, I think that their calculation is that as long as you show it quickly and it gets its moment on certain news channels, enough people will believe it that they've already done their damage. They've already won their propaganda battle.
Do you remember when they bombed the hospital? This is 1 year ago when they bombed the hospital in the north, الأهلي. مستشفى المعمداني. معمداني hospital.
Yeah.
When they killed 600 people one time.
Yeah.
And at the beginning they said, "Oh, this is not us. This is the wrong rock. Comes from the Hamas." They
said it was a Hamas rocket.
Yeah. Then Turkey, after the next day, they shows by the satellite that the rocks comes from the sky, comes from the Israeli airplane, and even the rock itself is still there. It's more the rock that they bump it for the hospital weight more than 1.5 ton.
So definitely not like a Hamas
Yeah.
small ordinance.
Dr. Ghassan City was there at that moment. The people that was inside the emergency room, the blood was like everywhere. He was in the procedure room. Tell me, what is this?
I think again, the only reason why it's allowed to continue is because
When
enough people believe the propaganda, the traditional story has always been in the Western media and Western culture, in America especially, is that Israel is the good guys.
Israel, when they go to the social media and the TikTok and giving her wife a gift of tank shell, bombed one of the mosques. What is this? He's doing this on TikTok. When one of the singer go signed the shells comes out from the tank to bomb the people there. No, why there's more than 75 soldier until now they killed themselves over there, Israeli. Why there's a lot of high percentage now in Israeli they don't want to go back to the armies. They refuse.
Mm-hmm.
Why? Why there's certain percentage of the people, those people who they are call them the religious Jewish and the Israel, they refuse to go to the army, and they said we will not be part of this this blood. Why? Why there's a lot of soldiers comes out that from there's one of the soldiers comes out from inside Gaza, and he said like we can't sleep like after we got order to kill one woman and two little small kids, 6 years old and 8 years old, because they are in close from our area. Mom and two kids, and they said we can't sleep. We every day they're coming our dreams. Why? Why they are celebrating by killing people?
Part of it too that I don't think people in America understand is that the Israeli population is highly propagandized. We had Israeli activists on the podcast like several months back. They were one of them is Israeli, Jewish Israeli. He's actually a politician, a local politician, and he's involved in this organization called Standing Together, trying to bring Palestinians and Jewish people together for peace and justice and equality and all.
And
this.
when we talk about Israeli, we talk about Zionists.
Yeah.
No, we're not talking about religion as a Jewish.
Right, absolutely. And so this Israeli Jewish activist, he was explaining to me, like I was asking similar question, like how can people believe this? How can people this? How can people just let this go on? He said in Israel, they convinced the population, Israelis, the government convinced the population that all deaths that happen in Gaza are Hamas deaths. So if 500 people get killed in a block of a neighborhood in bombing, or 50 people, women, children, it'll be the numbers 50. Let's say it's women, children, and men mixed together. They'll say 50 Hamas terrorists were killed.
They're not allowed
300
to watch
Hamas
any
terrorists.
videos comes from Gaza.
Yeah. The population literally, they got arrested. Him and another girl who was with him. She's a Christian Palestinian woman who's an activist with him. They got arrested for posting pictures of the dead civilians in Gaza,
My
in
friend,
Israel.
if you put like or comment or status
on social media
related to Gaza, you will be arrested.
Yeah.
Like or comment or status.
In Israel.
Yeah, I seen a Palestinian woman. She put like on one of the status WhatsApp for her families there. They took her and they arrested her.
Yeah, Americans don't see that. They don't understand that it's
No.
not functioning the way they think. Like Netanyahu comes on TV in America and he says, "We're the greatest democracy. We're a democracy in the Middle East, just like America."
We are the most ethical armies in
most
the world.
ethical. They don't understand that this is a master manipulator, a guy who knows how to sell something to a Western audience and tries to paint it as if their country and their society and their system they have over there with this occupation is being run the same way that Beverly Hills, California is being run. That's the way they portray.
Show me one point. Show me one picture. Show me one thing. Shows 1% of ethics for the Israeli armies, and I'm gonna do whatever you want. Man, they playing with people's life. They playing with people's life. Just to let you know, when we are in the hospital, all injured people come either shot in the neck and the hip. I'm gonna explain it to you. Either to make him die or to make him disability. That's it. Women, 27 years old. The last woman I've been in the surgery room doing surgery with the doctor Ahmed Abu Nada for her. She's go on the roof to check the water, if there is water in the tank, to do showers for her kids. And quadcopter, which is doesn't know the quadcopter, it's a small drone with a sniper on it, and it has the ability to send to bump rocks, 2 small rocks. They bump her with a rock, and they bring her to the hospital. Shahada, no, to European hospital, and we did surgery for her. It was 10% from, like, if I show you the picture, I have pictures, you're not gonna believe it. The whole legs, the only thing catching the upper and the lower part of her leg is the bone. There's no veins, no arteries. Maybe there's a couple, like, it's a big mess because she's checking the water. 4 hours procedure with 10%. Maybe she will be okay or not. And alhamdulillah, I mean, Dr. Ahmed Abu Nada, he made a lot of good work, and she's okay. I'm gonna give you something. I'm gonna tell you something related to this.
And for those listening, we're going to post these pictures. We're going to cut them in after the video. So you might have already seen them by the time this comes out, or you'll see them now. I'll put them in so you guys can see what he's talking about. Go ahead. Sorry.
One time, Dr. Ahmed Abu Nada, he was in with Dr. Dahoud Borde and a couple doctors, and with all was like in the emergency room. They call, hello, from the emergency. It's in the morning, was before Fajr praying. We are just on a line doing wudu. We're preparing ourselves to salah. So got phone from the emergency. There's a case with a gun. I remember it's a rocks. Yeah, most of his legs, I think, it's dropped, and they bring him from Shuhada Al Aqsa Hospital, and he was there for 5 hours, and there is no vascular surgeon there. So when they bring him back to the European hospitals from city to city, because they can't move just anytime, and then when they could have the ability to take him with the ambulance to the European hospital, and they called Dr. Ahmed to come down with the specialist to the emergency room. Come down to the emergency room. The guy, he's 25 years old. He's unconscious. His heart stopped bump in certain time while they are before they start even doing anything. About 5 hours of bleeding. And at that point, one of Dr. Ahmed said, bring us blood to let us just make him alive now, then we'll talk about the other things later on. So at this point, the nurse asks, like, what is his blood type? And the other nurse said, oh, I'm sorry, but we're out with the kit that we can't check his blood type. Oh, really? What are we gonna do? One of the doctors, he said, okay, just bring any kind of the blood. Doesn't matter. Let him just stay alive, and then we'll fix the other later on. And Dr. Ahmed said, no, just bring me O minus. You know, O minus give everybody. And the nurse said, hey, I'm telling you, he doesn't have blood in the hospital. You telling me give me O minus, which is like maybe the most
valuable thing.
Valuable in the world, not in Gaza.
Yeah.
Then at that time, what I'm gonna say now, it's not in Hollywood. It's not a movie. It doesn't take Oscar. This has happened in the emergency room of European hospital with Dr. Ahmed Abu Nada in Gaza. Okay, what he did, he said, "Okay, bring me cannula." Dr. Ahmed Abu Nada, his blood, his O minus, and while he's doing fixing the veins for the patients, he gave him his blood.
So he hooked up his own blood for a direct transfusion from him to the patient that he's working on.
Yeah. Not direct, indirect.
Okay.
And he's keep working on. So what I'm telling you now, from my start until now, you feel these hours. No, these are minutes.
Just one after another.
Yeah. But when you spread the information, you spread what happened there, these things, like when you think about it, like what you talking about? And also, after he, alhamdulillah, let his heart work again, pumped again. So that they said we will take him to do procedure for him. And Dr. Ahmed said no. Take him to the ICU. Put him under watching him on 24 hours. And we'll see him tomorrow. After he give him his blood and he makes sure that the arteries are okay and the veins are okay. And we sure that his life was safe now to watch him for 24 hours, because we can't do everything for him in the one things after thing. And he did the surgery for him, Dr. Ahmed, and alhamdulillah, he saved his life. He's 25 years old.
Wow.
Yeah. And one day I woke up here in Chicago, so I saw Dr. Ahmed send me a picture. I'm just watching, Dr. Ahmed, he's like my big brother. Those people, the people that I know from recently, but the people that I love more than anyone I know in my life.
Mm-hmm.
They teach me what I never had in the whole of my life. So he's sending pictures, so I open my WhatsApp and checking picture. Oh, Dr. Ahmed with a guy. Oh, picture. So I said, who's this? Do you remember the patient that we did surgery for him, then in the procedure in the emergency room, then we give him all minute blood? I said, yeah. He said, "This is the guy. He come to say hi for me.
Wow.
Our blood mixed together. Now he is my brother."
Incredible.
And talk about this a lot. If I want to send you the pictures for doctors, like what I know Dr. Ahmed, Dr. Hassam Abdul Hafiz, Dr. Dawood Borde. I don't want to forget. I know a lot of doctors. So Dr. Mohammed Abu Salmiye, a lot of doctors. So if I want to send you pictures for patients that they saved their life, you need a book of chapters to write these articles and send them back again to Hollywood to make movies that about what's going on there. Those people have believed in God that I never seen in anywhere else. And at the same way, those people are professional in a way. Don't tell me first, second, third, fourth word, I don't care. I never seen professionals like that from all country I visit, which is I go all around half of Europe and more than 10 states and Middle East.
You were telling me when we were talking earlier about, I want to focus a little bit on your specialization within wound care. You mentioned some of the challenges with wounds being infected, wounds getting maggots or worms inside of them. Can you talk to us a little bit about what your particular area of specialization and kind of what you had to deal with in terms of wound care? That were some noteworthy stories or situations that stand out.
Okay. And most of the ones there, most of it, for lacking of the antibacterial material and the antibiotics to make the wounds to be clean and to take care of it. For then the big huge number of patients that you can't make round for all over them and make change for on the wound for all of them. Because Israel bombed all hospitals and there's only 3-4 hospitals work in Gaza now, 50%, not 100%. So this patient, he live in one of the camps and he need to come over at like 2-3 miles. So he can't come over to the hospital because he doesn't have money to go with another one of the carts that the one of the animals carry, take him to the hospital. So this one will be infected. And we had a lot of issues there that we could not control. It's not we could not, we've like, okay, we found and we met a lot of hard situations, and I bet that that's something related for the weapons, because even Dr. Ghassan, they used to know what weapon used from the
Wound.
wound.
So based on the wound, they could tell what kind of weapon.
Yeah, like before this war, if you go back to war 2014, okay, when the patients come with part need to be amputated, the wound will be not clean, which is mean the part of the truck cut this place or this organ or this part, it's not clean. Okay, or it's not dimension of that part. It's not, let's say, knife enough to be cut at the hole.
Mm-hmm.
Since of 2020, 21, and 23 most, some amputated come to the hospital, amputate. The only things is maybe the last skin catching each other, and when you look at the bone, it's like زي المسقلة. It cut it 100% clean.
Mm.
That's giving you that idea of what the weapons. I don't know, like maybe the accident when it's pumped goes like, it looks like a knife. Cut it. It's clean and it's straight. It's telling you that there's different weapons that they try it. They now try it. Just so you know, Gaza since of 2008, it's lab for Israel.
Laboratory for
Yeah.
weapons manufacturers.
Yeah. It's a lab, and they goes in the for the other countries without mentions names. They say, see, this bomb will kill 500 people in one time.
Yeah, it's really not hard to conceive of, right? Like if you have a weapons manufacturer, they have a new ordinance, some new kind of R&D type of stuff, and they say, you know what, we have a partner in Israel. The defense community is very well tied in together, the defense network and all that. And they say, here, try this on the next battle deployment or whatever. And in a matter of a few months or, maximum 1 year, they have an opportunity to test it out
Tell
and
me
give feedback.
why Israel taking hundreds of dead bodies from the hospitals and bring them back after months. Why? Do you have an idea?
No.
Does anybody ask himself that? Why? Why they take hundreds of bodies? There are some of them, they take them out of the
Graves.
out of the graves, and and after that, at Al-Shifa and at Nasser Hospital. When I've been there, it's in front of a Dahle center, which is for dialysis, the biggest dialysis center in Gaza. There is like a square land there. They found hundreds of people. Some of them was alive.
They were alive when they were buried?
Yeah, some of them were alive. Because when you look at the patient, when you look at the dead body, there's no any signs of shooting, and even their hands are locked behind their.
They're bound.
Bound behind the back. That's telling you that why you gonna do that for a body?
It's already dead.
Yeah.
Yeah.
Well, not one, and not two, and not three, and not four. Some people, they are buried them with the papers of the hospital. Like, when you do admission, there's papers. Yeah, that's me. There's a beds of the hospital around that area. You feel that they are just flipping the beds inside the.
They were checked in.
Yeah,
Patients who were checked in.
they're checked in them inside. A lot of people kill people. You listen. You smell the dead. You smell the death bodies. everywhere in Gaza. Death smell everywhere in Gaza. And who's telling you this is a propaganda? Tell him, go check your heart. If it's still there or not. Who's seeing these photos and still negotiate and saying that this propaganda? Don't even waste your time with them. Those people, they're dead. And the people in Gaza, they're alive.
One of the situations that I try to tell people to envision that I've recently heard of was nursing mothers who don't have enough milk being produced or no milk being produced because they're starving.
Yes.
And they aren't able to feed their babies and their baby is starving.
They're taking expired milk.
Yeah. And those of us who have kids, we all remember, like at some point, if we have a wife who breastfed their kids, we all recall like the frustration of like when a mother's trying to calm a kid down, he's screaming and crying, and you have to get the baby to calm down before he can actually start suckling and drinking milk. And how frustrating the mother can be, like just a normal situation in America. And the mother will be frustrated because the baby won't drink and the baby's crying because they want to drink, and it's just a mess. It's chaos. And the mother gets so sick of like, here, take the baby. I need to just get out of the room and I need to breathe because it's so frustrating. I was thinking about that because I've witnessed that with our own kids being breastfed and stuff when they were little. But to imagine a mother who has a screaming infant that doesn't have milk and is starving, the baby is crying repeatedly because it's so hungry, and the mother doesn't have enough or any milk to be able to hold the baby to their breast and be able to feed them. It just, to me, just blows my mind, just because I know the frustration of dealing with a normal situation. But to imagine a mother have to listen to that baby screaming until basically the baby stops crying because it dies.
Do you know mother in Gaza now what they're doing? Moms in Gaza now.
Right.
No. Whoever have a little infant that need milk and there is no milk, either the dad or the mom, go around the camps, see whoever there is mom like just delivered recently, and ask for to feed this guy or this infant for a little bit of milk instead of his diet. And just to let you know, one of the levels, like when you go through the starving, there's levels. One of the levels is which is the kids or the infants start crying with non-stop. Then the level after, which is the stop crying and sleeping for a long time period because he's start taking the body start taking from the whatever muscles and under the skin, and after that the heart starts stop working, and and he did that. So you're saying, imagine that mom can't feed her infant. Imagine mom go around the camp to find the mom delivered to give a little bit of milk from like breastfeeding from any other mom because she knows that nobody's out milk, and or go buy one of the milk if you find it with for $200, which is expired for $200 expired milk, and feed it for yourself.
Yeah, it's unimaginable.
And start giving infants under 6 months, which is not right by the guideline. Giving him some instead of the milk because there's no milk. Start giving them hair pills, which is this will affect their body later on, because when the studies says that you can give the infant before 6 months other than milk, because their immunity system and their digestion system is still building up. So this infant, if he will stay alive, he will see these problems later on.
Yeah, all kinds of chronic health issues.
Yeah. He will find it. Do you think if the war stopped right now, that everything's done? We have 150,000 people injured. We have more than 17,000. I'm sorry, above 20,000 amputated patient. Most of them are kids. That means the only grown up. They're still under 16 years, under 14 years. That means this patient need another 3 to 4 surgery after the surgery that he's done. Man, me or you or one of the American people, doesn't matter what religion is, what ethnicity is, watching us, his wife or my wife or your wife, when she got delivered, and after delivery, when she feel like a little bit of depression, they start giving her sessions of
Psychiatric
after delivery, or depression after delivery. And how many behavioral health and how many surgeons that we need for those people? How many we need for Gazis? Who think about those people? 150,000. Oh, there's people, now they're in Gaza, they can't find any place to bury people. You know that?
Hmm.
See, in the middle, there's in the two ways of the street, there's a small like
Yeah, like that kind of raised, like
Yeah.
they might put flowers.
flowers.
Yeah, dirt in between the roads.
Yeah, there.
The median or the midway.
Yeah, they go there.
They bury people there.
Yeah. And there is no space now, no more. Some people, they will ask to excuse another people to bury their children in their other people's houses, and they promise them that they will take their body out again later when they find a place for him. And you telling me about humanity rights? Humanity rights dead. Nobody tell me about humanity rights since of today and go on. Nobody say about genocide happened to anybody before 2025, because we have one in 2025. So be updated.
And that's what I think that going back to the Tony Aguilar virality and on the Tucker Carlson interview, what I think has struck Americans finally, which people who've been paying attention to this for a long time are going, well, why did it take so long? Is that what I want people to understand or think about is really that all of the credibility and all of the positive, what do you want to call it, capital that the United States has accrued over many, many decades in terms of global image, in terms of global standing, has been completely eroded in what our government and what our system has allowed to occur in front of the world's eyes. I mean, if you're a Fox News watcher, if you're maybe a Republican, older Republican, if you're someone who just thinks that, there's absolutely no reason why the United States should doubt its support for Israel and what Israel's doing in Gaza, I need you to just consider something. Everything you've heard and everything that's starting to come out, the entire international community have been aware of what's going on for over a year, 2 years. And you believing what the government has been telling you this whole time, it only hurts the United States. To me, as an American born and raised here, I look at it with such shame and such sadness to think that all of this stuff has been done in the name of the American people. And for us as Americans to not stand up and protest and demand an end to this, to me is not just the least thing that people can do. It's people need to wake up. This is not about, okay, let's say you don't care as much about Gaza, you're not connected to that. For whatever reason, the moral argument doesn't appeal to you. What I would ask people to do is just think about it from a self-interest perspective. Think about it from a strategic self-interest perspective. If you love America, if you love your country, if you believe that America is a force for good, if you believe that our country should be a beacon, a light on the top of a hill, this is completely undermining and eroding any notion of that. Completely. And so I just want people to think about that and to really, start waking up and opening their hearts and their ears and listening to new information that they might not have been getting, such as what you've been giving us this whole time, Ibraheem, from your firsthand experience, and other outlets, online that have been putting out news for a long time. But I think just now people are starting to pay attention to in the West, in the United States particularly. I do have 2 more questions for you, if you have the stamina. I know we've been going for a while here. I want to ask one question, which I have to ask on behalf of all the naysayers, all the people who will listen to everything we've said, and they'll say one thing, and you know what it is, one word. They'll say Hamas. That's what you always hear from people who are on the other side of the aisle on this. In your experience in hospitals, clinics there, what has been your experience in terms of the hospitals and Hamas running around and just doing whatever they want and running these places like the way they portray it on the news? What have you seen?
Like this question, everybody asking me.
Yeah.
But I never seen anybody. None. None. Literally none. I care about humanity and those people, children's, women's, and elderly people killed for none reason. And I was there for for more than one time, and I never seen anybody holding a weapon. I don't know how I'm gonna know if he's Hamas or not even. But I'm telling you, I didn't see anybody holding a weapon.
So I have only 1 or 2 questions left for you to kind of bring us to the finish line on this incredible interview. What do healthcare workers in Gaza, or just Gazan people in general, want people outside of Gaza to know? What would be their, message to the outside world?
This is one of the words that I listened from Dr. Ahmed before one of the times that they kick us out of Gaza, which is when they close Ma'bar Rafah, when they closed Rafah border, and Israeli army get inside to Rafah. At that time, all organizers of the organizations come and take all doctors out of Gaza, because Israeli give them order that you have until 12 p.m. to take all medical missions outside Gaza, because we're gonna block and close Ma'bar Rafah. And this is for history and for people to know. When I get in at that time, Ma'bar Rafah was open, and there was no blocks between Rafah, between Egypt and Gaza. Before I talk about this, I'm gonna go back word a couple hours when I was still in the bed. I just woke up before I prepare myself to the round with Dr. Ahmed and Dr. Hussam Abdel Hafiz and Dr. Dahoud. They opened the door, knocked the door, opened the door. Hey, Dr. Ibrahim, Dr. Hussam, prepare yourself. We need to leave now. I said, what? I said, we need to leave now. I said, I'm not leaving. We're not in a party to leave now. We have mission, we need to finish it. We're still in the middle of the mission. They said, this is not optional. This is order and it's mandatory. You should leave. We keep negotiating for maybe 2 hours. Everybody get ready except me. And they bring all doctors like to talk to me to let me leave. Before I left, all doctors told us one word. Tell everybody about us. Because Gaza's people, they reach level of asking themselves, no way they start with Muslim. No way Muslims are see everybody, like see what's going on with us, and they're
doing nothing.
Then they go up one level. Oh, no way Arab see us, or they start with Arab then Muslim, see what's going on here, and they don't move. The word, no way the people who put and convince the word with the rights and human rights.
Yeah.
And talking about China because they have no human rights there. And going to Iraq for the human rights. And doing all this for the human rights. That no ways those people there see what's going on here and they're not doing anything. So please tell everybody about us. Let people know what's going on here. Because they can't believe that we're watching them and they're doing nothing. From this point.
Yeah.
Not from point like, oh, talk more. Or let's say, please. No. Because they can't believe that this going on happened here. This is what's going on here. And everybody's just do nothing. We're starving. We're killed. There's genocide. Man. Whenever happened in 7 October doesn't give anybody the right to kill every 15 minutes a kid. Why are you killing kids? Why are you killing women? 60,000 people killed, 75% of them women, elderly, and kids. 20,000 kids are being killed. 40,000 kids with no moms or dads or both. Who's gonna take care of those people? Who? We know that's God gonna take care of them. After that, we feel bad that we left them. Like, when you are with your brother at his house and one of the neighbors come to you and tells you, hey, there's like 4 bodyguards coming to destroy your brother's house and punched him because he did something, and they want to kill his kids and his wife too, and your mom with him. Then you come and leave him and go outside. Do you feel
Right.
like Dr. Hassam, he was telling me, Ibrahim, is this tawalli yawm al-zahf? I swear, I tried to stay and they refused. Then they took us. Now I'm going to tell you about what we was talking about before. No, before that, we prepare ourselves in the hospital. Everybody was ready. I'm the only one. Dr. Ahmed told me, Ibrahim, just leave and tell people about what's going on here. This was the point. Say they took us to Ma'bar Rafah border, and when we was there, you can see it's like open land. We watch. There's not something new. What is it? Blocks, maybe like 12 inches wide, with height 8 feet, 9 feet. From the beginning of the border till the end. And there's only 2 open, and they put them on the side. So we go through Rafah, we go through Palestine, Gaza side, and they, passport, and they stamp your passport to leave because you left. And we get inside the bus, and I'm telling you, for the history, to record that I'm one of the last people who left Rafah before they closed it, which is before Egypt closed the border. And when we was there, the rocks start pumped all area around us. Even the windows and the glasses for the building of the passport, where you stamp your passport and your luggage for the Egyptian side, it's all from the how much these rocks are strong enough to shake the land. All glasses or windows are broke. And when we left, there is a big bulldozer take these 2 blocks and lock the way. Do you know when you feel that when you leave your brother's house and you tell him, please, when you die, try to be not loud. Rest in peace. You feel that you say it for people in Gaza while they are alive. Which has happened. But before I go to tell you about another story related to this, I just need you to feel what we was feeling when they kick us, when they blocked that.
Take your time.
They don't deserve that. Because it's people that don't deserve that. They're better than us. I swear to God, they're better than us.
So let me ask you a question in closing. What do you think people can do if you can direct people's energy who want this to stop, people who want this to stop, if you can direct their energy in one or two directions, like in one area, one focus, or if you keep it simple, what would you want to see more people in the United States doing that could help potentially bring this to a stop, if anything?
Don't stop talking. Don't stop mention using whenever you can use social media. Anything that you are able to do, don't stop talking. Even if you are say one word every day, but don't stop talking. They ask one of the prime minister lady, or if I'm not wrong, they ask her, how you guys change what it used to do or what it used to have in your countries in South Africa. She said, and he asked her, like, what do you advise us to do as a Palestinian? She said, don't stop talking. So he asked her, like, how? She said, we used to go, instead of all together, 2-3 people every day. If you are 1,000 people, instead of go one time for one day every month, no, go all 3 people together for 1 year. Those kids' blood's in your neck. God will ask everybody. God will ask anyone has anything can do, even if it's a word. And he did not. God will ask anyone that close his eyes on the starving and death happen now in the Gaza and sit down on a table with all kind of meats and food to eat and throw more than half of it. God, Allah subhanahu wa ta'ala will ask every Muslim and not Muslim about this.
I'd like, go ahead, sorry.
All these, Allah subhanahu wa ta'ala روح المظلوم تعلق بعرش الرحمن.
The oppressed soul is, I'm trying to translate for you. The oppressed soul is stuck underneath the throne of God the merciful. Is hanging from the throne of the God the merciful.
إلى أن until the day that God, until the day that Allah give back حق المظلوم من الظالم. Even Allah will say وعزتي وجلالي لأنصرنك ولو بعد حين. Doesn't matter if this Muslim or not Muslim. Allah حرم الظلم على نفسه فجعله بين الناس محرما.
God forbid injustice, and He forbade it between people.
Also, words, all new words, all new things happened that we never saw before. The sole survivor, one of the sole survivor, he was in the ICU. His name's Hamza. One of the press ladies used to go to the ICU every day, check the kids. How many kids here? I hear her. I thought like his relatives were her. Then she said, no, he's a sole survivor. And I did hear what she praying. She prayed for him. I did hear what she prayed for him, which is, I got like confused because these words we used to say to our people who's already died. And we like after he's dying, we say, Allahumma abdilhu daran khayran min darihi wa ahlan khayran min ahlih. So please, Allah, give him a home better than his home and a family better than his family. This is what we said for people already dead.
Mm-hmm.
So I get confused that she's saying for he's still alive. She told me he have 2 amputations, a lot of issues. He can't move. Nobody will take care of him. So I think the better home for him will be عند Allah. This is what Israeli change concepts of humanity which is let people start praying to death, praying for a couple kids to be die instead of staying alive, because if he stayed alive, he will be by himself. Nobody will take care of him while he's amputated and disability, without family, solo survivor. Solo survival. And I'm just keep asking myself, after the war stopped, how many family they will run to their destroyed houses just to let you know, there is no family in Gaza without Shahid now. Every family
Has lost someone.
has lost someone, or still someone of their families under rubble, looking to go back, find him. Israel bombed 360 kilometer square with almost 100,000 ton, which is when you divide it, every single person in Gaza has almost 150 or maybe 20, 200, 200, yeah. This is the human rights.
Well, I think us having this conversation and getting your firsthand experience, having been in Gaza, was critical. I think it's important that this is shared as broadly as possible. So anyone listening, please, please, please share this with people that you feel like need to hear it. I feel like oftentimes we share things with people we already know. I would encourage people to try to find this podcast as a resource for those who don't know, friends, family, people who just have not heard the facts, have not heard the stories and testimony of Dr. Ibraheem Barhouma. And also, please do your best to try to share with people that you disagree with. Don't share stuff like this only with people who agree with you. Share it with people who disagree with you, because we need to change people's minds quickly, and we need to keep building pressure in the international community from the United States, first changing our own position as a country, and also within the Western international community as quickly as possible in order to stop further death and killing. I can't emphasize that enough. Just share it as much as possible and educate people. And lastly, I'll say, don't forget to please, please, please subscribe to the channel. And I'm going to put some links and information in the description that'll have information that Dr. Ibraheem Barhouma is really adamant that could be resourceful for people, links, any kind of information that you think is important that you want to refer people to. Some of the names of some of the more famous and prominent doctors and voices from inside Gaza, if they are appropriate to share, we'll share those. Anything like that will be in the description of the video. And again, please do everything you can, folks, to spread awareness on this issue as much as possible. Dr. Barhouma, thank you so much for joining me today and sharing your experience in Gaza. It's absolutely been an honor, and it's definitely just impacted me and changed me in ways that I didn't even think was possible at this point, having witnessed everything from my phone this entire time, but just sitting with someone who's seen it with their own eyes, who I can tell has been impacted by it and affected by it in such a deep way. it hits particularly hard in my heart and in my soul. And it's definitely something that will continue to weigh on me and those around me for many, many years to come, undoubtedly. Thank you so much for being here. Thank you for going through all the details. I know it's difficult at times, but I think it's important, and I know you do as well. So thank you so much.
Thank you so much, Omar. At the end of the conversation, I would like to say thank you for everybody who watched, and thank you for the message that you're trying to deliver. And I will say sorry for the people who asked me to speak in Arabic, and I promised them that we will make another one in Arabic, inshallah.
Yeah.
And
I can clarify that. So this was English. We chose English for the first one because we need more and more people who are non-Arabic speakers, who are not as familiar with the issues, that get their news from different sources than Arabic speakers do, to get exposure to this information. But our goal is to have a follow-up, repeating some of the stuff we already talked about, but also additional stuff in Arabic, more geared for an Arabic audience.
Well, at the end of the conversation, I would like to say أشهد الله سبحانه وتعالى بأن كل كلمة قلتها إما رأيتها بأم عيني أو سمعتها من أصدق الناس اللي موجودين معي هناك، وأني أبرأ إلى الله تعالى من كل متخاذل ومتعاون ساعد بتجويع وقتل أهلنا في غزة. Thank you so much.
Thank you, Dr. Barhouma. Appreciate your time.
السلام عليكم.
السلام ورحمة الله.
إبراهيم شو بتكتب؟
والله يا محمد عم بكتب قصة النادي الوحيد حمزة الفرة، مصطلح جديد دخل علينا من يوم 7/10. ما أكثر المصطلحات اللي علمتنا إياها غزة. النادي الوحيد حمزة الفرة عمره 8 أعوام، كان موجود بالمستشفى وبإحدى الراوندات وأنا بتابع شيء مع الأطباء. طبعا حمزة ما ضل ولا أي أحد من أهله كامل، انشط بالسجل المدني كامل لم يبقى إلا حمزة الفرة. حمزة كان عنده جروح سيئة جدا، ومن قلة المواد اللي تستخدم حتى يتم تنظيف الجروح فيها صار مع حمزة التهابات وأصبح الدود يخرج من جروح. فسمعت واحدة من الصحفيات بتحكي كلمة أنا يعني تغير كل معالم وجهي. تخيل محمد إنه إحنا الكلمة اللي بنستخدمها تبعت اللهم أبدله خيرا، دارا خيرا من داره وأهلا خيرا من أهله، إحنا بنستخدمها للميت. في غزة ترى استخدموها للحي، إنه هو هلا ما عنده أهل وكله جروح وألم والدود عم بيطلع من جميع جروحه، فبتحكي له اللهم أبدله دارا خيرا من داره وأهلا خيرا من أهله حتى يروح عند ربنا. تخيل. ومع هيك ثاني يوم جينا عليه لقيناه متوفي، كأنه ربنا استجاب له. مركز الدغم، مركز جهاز غسل الكلى. أجهزة الكلى وغسيل الكلى، سنتر غسيل الكلى في المنطقة، مستشفى ناصر. حسبي الله ونعم الوكيل. من المفارقات الصعبة جدا إنه عند دخولك غزة تشعر بشعور راحة بال لا تشعر بها بأي مكان على وجه الأرض. ولما تدخل جوا غزة وتباشر العمل في المستشفيات في راحة وطمأنينة مش موجودة في أي مكان ثاني. تزعل كثير لما تشوف الحالات والناس الشهداء والمفقودين والناجي الأول والناجي الأخير، ولا زال الناس تحت الأنقاض وأمور أخرى جدا كثيرة. ولكن تزعل لما تيجي تغادر غزة أكثر مما تزعل أنت داخلها.